So why is it bad to have a personality disorder? Worse adherence to treatment, worse treatment response, particularly to medications. You have more recurrence of depression and anxiety. Risk of suicide goes up. You don't do well at work. You don't do well at home, right? Increased violence and impulsivity. So having a personality disorder as a psychopharmacologist, to me, levels the playing field a little bit, right? So being traumatized, you heard about this, changes your brain, right? You're not going to respond as well to medications. Having a personality disorder, some have trauma, some don't. I think brains are different. I have a couple slides on that. They tend not to respond as well to meds, right? Being addicted, smoking weed 18 times a day, you're not going to respond as well. So addiction, trauma, personality disorder, in my world, the treatment-resistant depression, those are the three culprits that most of the time lead to treatment resistance. Yes, you can meet a patient as none of those things. They have horrible to treat depression. It's like cancer, diabetes, blood pressure. They're just some almost untreatable conditions, right? So some people just have bad depression. But if you really go hunting for it, trauma, addiction, personality disorders really makes our medicines work suboptimal.